নমস্কার, দেখছেন কলকাতা টিভি। সঙ্গে রয়েছে আমি স্বর্ণালী। শুরু করছি আমাদের বিশেষ অনুষ্ঠান ডাক্তার বলছেন। আর ডাক্তার বলছেন আজ আমরা আলোচনা করব এডিমা অ্যাওয়ারনেস নিয়ে। বিশ্বব্যাপী আমরা দেখেই থাকি যে লক্ষ লক্ষ মানুষ কিন্তু এই এডিমা রোগের দ্বারা আক্রান্ত হয়ে থাকেন এবং বেশিরভাগ ক্ষেত্রেই দেখা যায় তাদের মধ্যে অত্যন্ত কম সচেতনতা রয়েছে এবং বেশি সচেতন করে তোলার জন্য সেই মানুষগুলোকেই কিন্তু প্রত্যেক বছর আমরা দেখে থাকি এই 25শে সেপ্টেম্বর এই দিনটিকে ন্যাশনাল এডিমা ডে হিসেবে পালন করা হয়। ঠিক সেই বিষয়ে আমরা আজ আলোচনা করব। আমাদের সঙ্গে উপস্থিত রয়েছেন বিশিষ্ট চিকিৎসকরা। রয়েছেন ডক্টর ইমরান আহমেদ, ক্যালকাটা মেডিকেল কলেজ অ্যান্ড হসপিটাল। রয়েছেন ডক্টর সুমন্ত চ্যাটার্জি, ম্যানিপাল হসপিটাল, সন্তোষপুর, কলকাতা। রয়েছেন ডক্টর আশরাফুল হক, পার্ক সার্কাস ক্রসিং, রৎসা ডায়াগনস্টিক্স। রয়েছেন ডক্টর বাপ্পাদিত্য কুমার, আমরি হসপিটাল, সল্ট লেকের সঙ্গে যুক্ত এবং রবীন্দ্রনগর ক্লাব, ডানকুনি। রয়েছেন ডক্টর শিলাঞ্জন রয়, চারনক হসপিটাল, কলকাতা এবং আরবি ডায়াগনস্টিক, লেক টাউন, কলকাতা থেকে। আর প্রথমেই আমি আসবো ডক্টর আশরাফুল হক আপনার কাছে। ডক্টর হক, আপনার কাছে যে বিষয়টা আমি জানতে চাইবো সেটা হচ্ছে যে এই এডিমা রোগটি ঠিক কি?
Edema is the clinical condition when excess fluid accumulates inside our body. The common manifestation is leg swelling.
আমার পরের প্রশ্ন থাকবে ডক্টর বাপ্পাদিত্য কুমার আপনার কাছে। শরীরের কোনো অংশে জল জমলে কি তাকে এডিমা বলা চলে?
Edema is collection of excess amount of fluid in dependent parts of the body. Fluid may accumulate in our legs or in the sacral area.
আর এবার কথা বলে নেব ডক্টর ইমরান আহমেদের সঙ্গে। ডক্টর আহমেদ, এই এডিমা রোগ কি কারণে বিপজ্জনক এবং কি কি ক্ষেত্রে বিপজ্জনক?
Edema, as we know, is the abnormal accumulation of fluid in the body. If it is unilateral, that is with one side of the body, especially in the legs, that's more dangerous. That indicates local causes like vein which has got clotted or filariasis. On the other hand, if the edema is in both the legs, then it could be with age, the valves are getting weak, the valves of the veins are getting weak. So that's a much easier disease to manage. But sometimes it reflects systemic diseases like heart failure, like liver disorders, like liver cirrhosis, kidney diseases, as well as some diseases related to hormone problems like thyroid problems.
আমার পরের প্রশ্ন থাকবে ডক্টর শিলাঞ্জন রয় আপনার জন্য। অ্যাডভান্স লিভার ডিজিজ বা লিভার সিরোসিসের ক্ষেত্রে এই এডিমা কতটা হওয়ার সম্ভাবনা থাকে এবং সেক্ষেত্রে চিকিৎসা ঠিক কিভাবে করা হয়?
In advanced liver disease or chronic liver disease that we tell, or in liver cirrhosis, there is inability of the liver to produce albumin, which is one of the major contributors of the colloidal osmotic tension or the hydrostatic pressure. Because there is a decreased albumin production from the liver, there is decreased osmotic pressure in the plasma that results in leaking out of the plasma or the serum from within the blood vessels into the surrounding tissue or the interstitial space. That leads to generalized edema or anasarca in a patient of liver failure. Also in cirrhotic patients, there is another problem that is called portal hypertension that leads to increased portal venous pressure, and there is oozing of fluid within the abdomen that leads to fluid accumulation inside the abdominal cavity, which is also called ascites. So in patients of chronic liver disease or cirrhosis, edema can manifest not only as leg swelling or extremity swelling or body swelling, but there can also be significant fluid accumulation within the abdomen in the form of ascites, and these ascites or edema needs to be treated by various measures, lifestyle and dietary modifications in the form of salt restriction. Some medications may be required like diuretic therapies, medications like spironolactone that helps to remove the excess of the fluids from the interstitial space, thereby reducing the edema and the ascites. In severe cases of ascites or excessive fluid accumulation within the abdomen, paracentesis or removal, direct mechanical removal of the fluid from the abdomen is at times needed or warranted. And in advanced cases of liver failure, where ascites or the other components of liver failure cannot be controlled with medications and paracentesis alone or by IV albumin infusion alone, patient may require liver transplantation also.
আমার পরের প্রশ্ন ডক্টর সুমন্ত চ্যাটার্জিকে। আচ্ছা, এডিমা কি সবসময় কোনো শারীরিক কারণে হয়ে থাকে নাকি তার জন্য কোনো ওষুধের পার্শ্ব প্রতিক্রিয়া বা বাহ্যিক কারণেও হয়?
Edema is abnormal accumulation of fluid in our body parts. That shouldn't happen. Usually it means edema in dependent parts, that is pedal edema. I mean edema in legs. There is swelling in legs initially in the morning parts, and then as the day progresses it usually diminishes in the afternoon and the evening. Most commonly happens in elderly female patients. So what are the reasons behind this edema? So not all pedal edema are that much pathological, definitely. Some side effects of antihypertensive common drugs like amlodipine and blood pressure per se, anemia, these can cause edema. But some serious ailments like kidney disease, heart disease, liver disease, they cause edema. The excess fluid gets accumulated in some body parts like legs. And ascites, I mean fluid accumulation in abdomen, that is called ascites, fluid accumulation in lungs, that is called pleural effusion, or heart, that is pericardial effusion. These are all part of the generalized edema. So whenever you are feeling that something is going wrong, something unusual, you are, edema happens, but this is a more refractory kind of thing, more severe kind of thing, you must visit your doctor. There are some tests like ECG, echocardiography, liver function test, kidney function tests, USG scan. So these battery of tests can diagnose what is the exact reason behind your edema. There are medicines also, and some diuretics that reduces your edema, that produces more amount of urine or excretes through your kidney excess water, and that reduces edema. But most of the time we need a concrete diagnosis before this treatment, otherwise this will recur. So be vigilant. If you are having excess amount of water in your body parts like pedal edema, so go to your doctor.
ডক্টর আশরাফুল হক, এই এডিমার কারণ কি রয়েছে এবং এক্ষেত্রে কি পার্থক্য রয়েছে?
The causes of edema are different. Some are systemic and some other localized cause. Systemic like cirrhosis of liver, congestive cardiac failure, and chronic kidney disease. And localized are because of thrombotic obstruction of the limb vessels or local thrombophlebitis.
ডক্টর বাপাদিত্য কুমার, এই এডিমা রোগটি ঠিক কেন হয় এবং কি কি কারণে হয়ে থাকে?
Edema can occur because of local causes, for example, infection of the limbs or venous thrombosis, that is occlusion of a vein, or it may occur due to systemic causes. What are the systemic causes? Systemic causes are heart failure, kidney failure, or in patients with cirrhosis and hepatic dysfunction.
ডক্টর ইমরান আহমেদ, আপনার কাছে আসবো এবার। এই হার্ট এবং কিডনি এডিমা ম্যানেজমেন্টের ক্ষেত্রে ঠিক কি ভূমিকা পালন করে?
Okay, now both heart and kidney are related to management of the blood volume, the water content. The heart needs to pump the blood effectively 70 times in a minute, and the kidney has to continuously work full time, and the excess volume of the body is excreted out by the kidney through the urine. If the function of the heart or the kidney is hampered, there will be water accumulation in the body, and the initial signs of failure of either kidney disease or heart disease is the accumulation of fluid through gravity in the legs, and that causes edema. So as the heart failure progresses or kidney failure progresses, the edema progresses, and it can involve the upper parts of the thighs, and in the upper arms also there might be fluid accumulation, as well as sometimes in kidney diseases you get the accumulation of fluid around the eyes too. So the treatment also might also give some response. So the response to treatment would then decrease the edema, and if the edema is not decreasing with treatment of the heart failure or kidney disease, that also indicates that it is either inadequate treatment or it is not responding to the usual treatment.
ডক্টর শিলাঞ্জন রয়, হার্ট বা কিডনি ফেলিওরের কারণে কি এডিমা হয়? কেন হয়?
Heart failure is a condition where the heart is unable to pump blood efficiently into the body. In heart failure, The major symptoms are breathing discomfort or shortness of breath on exertion, easy fatigability, and swelling of the extremities, primarily leg swelling. Now, in heart failure, what happens? There is an increased pressure inside the veins of the body, and because of this increased venous pressure, the fluids and the electrolytes from the veins, it leaks out into the tissue surrounding the veins or in the interstitial space. This leads to edema and swelling of the extremity. So, edema is one of the major symptoms as well as the sign of heart failure patients. Now, regarding kidney disease, kidney we all know is the major organ of the body which maintains the fluid balance, the acid base balance, and maintains the electrolyte balance in the body. In case of kidney dysfunction or kidney failure, the kidney is unable to filter out the waste products and the fluids from the body, and there is accumulation of fluid inside the body, which leads to swelling of the extremities. So, in both heart failure and kidney disease, there can be leg swelling or edema, which is one of the major symptoms, and it should be, identified and treated accordingly.
ডক্টর হক, আসবো পরের প্রশ্ন নিয়ে। যখন ডাক্তার এই এডিমা রোগটি ডায়াগনোসিস করেন তখন ঠিক কোন কোন কারণ দেখে করেন?
When we detect edema in any patient, at first we have to evaluate by clinical examination of the patient what are the possibility or what is the provisional diagnosis that causing edema. So, according to the patient's history, we have to take proper history followed by diagnosis so that we can pinpoint or some diagnosis. What from that diagnosis we choose one diagnosis after investigations. So, we have to take thorough examination of the patient and other relevant clinical tests so to diagnose the cause of edema. Suppose we have a patient of edema, we have to do proper clinical examination, then we have to do some test like ECG, echocardiogram to rule out any cardiac condition, routine blood test like LFT, urea creatinine, sodium potassium to detect any kidney disease or liver disease. So, after this test we can screen out what are the possibilities of the diagnosis which are causing edema.
ডক্টর বাপ্পাদিত্য কুমার, এই এডিমা রোগের চিকিৎসা কিভাবে করা যায় এবং মেডিকেল ম্যানেজমেন্ট কিভাবে হয়?
Edema can be treated by salt restriction and by use of diuretics, that is furosemide or torsemide. But most importantly, while managing edema, we have to find out the cause of edema, whether the edema is localized to a particular portion of the body or it is generalized edema, that is edema affecting both the limbs, facial puffiness, swelling in the abdomen. When there is generalized edema, there is definitely some systemic causes of edema. For example, involvement of the heart in the form of heart failure, or involvement of the kidneys in the form of kidney failure, or sometimes it may occur in hepatic dysfunction, that is diseases of the liver. So, we need to look into the systemic cause of edema and manage those causes for effective treatment of edema. Why edema is important? Edema is important because it may point to some systemic diseases, and if not detected early, it will lead to further damage and may increase the risk of mortality and morbidity of the patient.
ডক্টর ইমরান আহমেদ, এই এডিমা রোগের কি কি উপসর্গ বা সিমটমস রয়েছে এবং রোগী কিভাবে বুঝতে পারবে যে তার শরীরে এডিমা হয়েছে?
So, edema by definition means accumulation of fluid in the below the skin. It is evident most commonly in those areas in which gravity is acting, that is near the ankles. So, the near the ankle swelling in the feet. But if a patient is always lying down, then edema occurs in the sacral area. There is puffiness in the sacral area, and if you press a finger in that area, there will be dipping. So that's called the pitting edema. So edema appears mainly in the feet as well as in the gravitation part if the patient is lying down. That's near the sacral region. But if it progresses, the condition which is causing the edema is not treated, then it progresses to the upper parts of the thigh as well as the upper arm, and sometimes in the abdomen, where there will be bloating of abdomen with fluid. So the causes have to be addressed, for which you might need to do a test for the heart, that's echocardiography, for the kidney, the ultrasound, for the liver also ultrasound and the liver function test, as well as sometimes thyroid might be the cause.
ডক্টর শিলাঞ্জন রয়, এডিমার জন্য পেশেন্ট এডুকেশন কতটা জরুরি এবং কেন জরুরি?
Patient education is vital for management of edema. As I have discussed that edema or this limb swelling, leg swelling, hand swelling, this is one of the major features or cardinal features of both heart failure and kidney failure. It is very important for the patient to be aware that it is, worsening of the edema or increase in this swelling indicates worsening of the underlying heart condition or kidney condition also. So proper education, awareness regarding edema, when the patient should, how the patient should identify that his edema is increasing or the swelling is increasing, and immediately that needs to be notified to the physician, so that early medical management should be initiated and lifestyle modification should be intensified, so that the heart failure or the kidney failure doesn't worsen. That is a key component of the management of heart failure and kidney failure patients. That's why patient understanding of the edema, when the edema increases, how it should be detected or identified by the patient himself, and when to notify to the physician, concerned physician, is very important for the treatment of heart failure patients as well as for kidney failure patients.
এডিমা সম্পর্কে আজকের এই আলোচনায় অংশ নেওয়ার জন্য আপনাদের সকলকে ধন্যবাদ। এবং একই সঙ্গে আজ আমরা এই আলোচনা থেকে যে বিষয়গুলি সম্পর্কে জানলাম, যে এডিমার যে লক্ষণ বা সিমটমস থাকে সেগুলোকে কিন্তু কখনোই উপেক্ষা করা উচিত নয়। নিয়মিত স্ক্রিনিং করা উচিত এবং অবশ্যই প্রাথমিক পদক্ষেপও কিন্তু নেওয়া উচিত। আপনার বা আপনার প্রিয়জনের কারোর এডিমার কোনো উপসর্গ যদি দেখা যায়, তাহলে অবশ্যই চিকিৎসকের কাছে গিয়ে পরামর্শ নিন। এবং একই সঙ্গে আসুন আমরা সুস্থ থাকি এবং স্টপ দ্য এডিমা মার্চে অংশ নিই। সুস্থ থাকুন, ভালো থাকুন, দেখতে থাকুন কলকাতা টিভি, রাত দিন 7 দিন।